Welcome back to the Seth Leibson Show as we head into this Wednesday, July 28th, 2021, 602-508-0960 is the number if you want to call in any topic we talk about or anything you want us to talk about. Happy to do it, and love doing it with you. If you, I meant to do this yesterday, and just the two major stories of the January 6th hearing and the new CDC guidelines crowded it out. But I did want to mention, we say politics and culture, and then it's a bloody crossroads when they intersect. I wanted to talk about Simone Biles withdrawing from the Olympics. If you put in, let me start that sentence over. If you have watched that story for the last, 72 hours, you've seen it change. And I don't know if it'll change yet again, but it's changed about 3 times. At least the analysis of it has changed. I don't know that she's changed since she withdrew, but the analysis of it has changed. To now the issue being lay off her mental health. If you type in Biles, B-I-L-E-S is her name, and mental health, you get, in less than a second, 174 million hits. It's layoff because of mental health. Please understand, because of her mental health concerns. Take her mental health concerns seriously. You don't know what she's been through. The training was incredible. This is a lot to put on a 24-year-old. It is the weight of the world, as she said. Let's hear her in her own words, Bill. Would you mind?
I say put mental health first because if you don't, then you're not going to enjoy your sport and you're not going to succeed as much as you want to. So it's okay sometimes to even sit out the big competitions to focus on yourself because it shows how strong of a competitor and person that you really are, rather than just battle through it. No injury, thankfully, and that's why I took a step back because I didn't want to do something silly out there and get injured. So I thought it was best if these girls took over and did the rest of the job, which they absolutely did. They're Olympic silver medalists now, and they should be really proud of themselves for how well they did last minute having to go in. And it's been really stressful, this Olympic Games, I think, just as a whole, not having an audience. There are a lot of different variables going into it. It's been a long week. It's been a long Olympic process. It's been a long year. So just a lot of different variables, and I think we're just a little bit too stressed out. But we should be out here having fun, and sometimes that's not the case. I just felt like it would be a little bit better to take a back seat, work on my mindfulness, and I knew that the girls would do an absolutely great job, and I didn't want to risk the team a medal for kind of my screw-ups because they've worked way too hard for that. So I just decided that those girls need to go into the rest of the competition.
You don't hear someone there that's in the grips of in the grips of a disease that prevents her from being articulate. You do not hear someone, and this can obviously be, temporarily adjusted given the way mental health issues arise, given the way medicines can sometimes work. But you don't hear someone in that press conference in the grips of a breakdown. And we have seen athletes in grips of breakdowns, particularly after losses. You do find, however, after all the criticism of her, I think much of it, frankly, warranted, the focus now is to defend her based on mental health. And one column, of course, has to inject race. You knew that was going to happen, didn't you? We'll get to that in a moment. But the mental health aspect, defending her, that we should take seriously what she has to say about mental health. We should give her a break because she has some mental health issues. Perhaps it was even more brave of her to come out the way she did than to compete and admit to the world that she had issues with her mental health. And I have to tell you, I'm not buying it. I'm not buying it, not because of her and not from her. I'm not buying it from the media that is cramming this down our throats right now. I'm not buying it because for years and years we have been talking about mental health, particularly youth mental health. Throughout the entirety of last year, as early as March, I was writing columns with Dr. Bennett on the risks to the mental health of our youth given the policies that were being enacted and punishing them and harming them because of a disease that affected our elderly. Eleanor McCants-Gatz was the Assistant Secretary of Health and Human Services, a double doctor, a PhD and an MD, a psychiatrist and an epidemiologist, and a psychologist. She gave a major speech on the mental health effects of keeping children out of school, and I read it verbatim with no editorial comments, and YouTube banned it. This was the Assistant Secretary of Health and Human Services, not for the state, but for the country. She gave that speech last April. Happy to read excerpts of it. But remarkably, one part of that speech she gave, she said, "It's important to point out that pre-pandemic, we lose about 120,000 lives a year due to drug overdoses and suicide. How many more lives are we willing to sacrifice in the name of containing the virus?" Well, we know the answer. It's not 17,000 more deaths, because that's what we lost last year using this very math to mental health problems. If you put drug overdose and suicide together, the highest drug overdose rate in their history, highest overdose rate and number in the history of this country at 93,000, and something like on the order of another 44,000 in suicides, deliberately suicides, not to mention drug overdoses. That gets you 137,000. Eleanor McCants-Gatz was worried about 120,000 lives. Meantime, you have study after study showing the negative effects these disease mitigation efforts have on our children, including the study I have quoted before on this show of 25,000 school-aged children who have revealed that they suffer from 24 distinct health issues associated with wearing masks, including increased headaches, difficulty concentrating, drowsiness or fatigue, malaise, and nearly a third of children experiencing more sleep issues than they had previously, and 25% of the children saying they're developing new fears. When you take children and yank them from their traditional daily routines of education and social activity and athletic life and after-school programs and after-school clubs and friendships, you are doing dramatic damage to that child. You are effectively doing to that child's emotional and mental health what whiplash would do to their spine, because you are putting them through a psychological and emotional whiplash. Again, for a disease that will not harm them any more than a bad year of the flu, for which we did none of this. That's taking them out of school. Now add masks. Increased headaches, difficulty concentrating, drowsiness or fatigue, malaise, and nearly a third of the children with sleep issues, and 25% saying they had new fears. The NEA and the AFT yesterday couldn't jump fast enough to support the CDC's guidelines that now say children, even vaccinated children over the age of 12, need to wear masks in schools, as do faculty, as do staff at every school. Don't tell me about the Biles story and tell me you take mental health seriously. We have been pushing the mental health issue for years, and the children have been telling you. Do you remember the gun shooting at the STEM school in Denver 2 years ago? It was a tragic school shooting. And the students held a memorial rally for their fellow fallen compatriot students. And guess who rushed in? Professional politicians to speak about the Second Amendment. What did the students do? They marched out. But they didn't march out quietly. They marched out in 2019, a year before COVID, chanting mental health, because they know that's the real issue, as I do. As you would know if you two are being honest. Don't give me this Simone Biles as the new face for it. We have 137,000 people that died last year with mental health issues. Given the dramatic lurches the society put them through, we should have understood why we were told. But the progressive left and YouTube censored us.